Good day, everyone. Welcome to another episode of Secondary Podcast. My name is Dr. Tiwa, and today we're going to talk about heart attack, understanding the signs so as to save lives. Have you ever wondered how the heart signals for help before heart attack strikes? Sometimes it's a scream, other times a whisper. Recognizing these signs early could mean the difference between life and death. Heart attack, also known as myocardial infarction, is a medical emergency that happens when blood flows to a part of the heart that is blocked, often by a clot. Without restoring oxygen-rich blood, that part of the heart begins to die. The damage is swift, but the warning signs often come slower, and they're not always the dramatic chest-clutching moments that we see in movies. So what are the things we need to look out for? First, chest discomfort. It could feel like pressure, squeezing, or fullness in the chest. It might last a few minutes, or it can just come and go. It is not always severe. Sometimes it is subtle, but it is never something to ignore, especially if you're someone that already has hypertension. Secondly, pain behind the chest. The discomfort may spread to the arms, the neck, the jaw, the back, or the stomach. For some, it might feel like, oh, this is indigestion, or you might feel like, oh, I'm having an ulcer, like ulcer pangs. While for others, it's a sudden sharp pain. Pay attention to unusual sensations that persist or worsen that happen behind your sternum. That's the center part of your chest. Thirdly, shortness of breath. Feeling winded without doing much. If it happens suddenly or alongside this chest discomfort that we talked about, it's a red flag. Your heart and your lungs work in tandem. So when one struggles, the other one follows. Number 4, cold sweats, nausea, or lightheadedness. Imagine breaking out in a sweat in a cold room, feeling nauseous without any clear reason. It might not always be pregnancy for women, or suddenly feeling dizzy. This could be your body's way of alerting you to a cardiac problem. Fatigue, especially extreme unexplained fatigue, especially in women, can be a warning sign of heart attack. It is not just tiredness when you feel unusual or feel overwhelmed. That is why acting fast matters. The heart is a muscle, and time is very important. Every minute counts in a heart attack. The sooner blood flow is restored, the less damage is done. That is why it is critical to recognize these signs and act immediately. What should you do? If you or someone around you experiences these symptoms, don't hesitate. Call emergency services right away. Some fast measures can be made immediately when the emergency services arrives, especially by a healthcare professional, that would help in keeping the blood flowing while waiting for help or while in transition towards a hospital. Prevention is power. Take care of your heart now so that you can reduce the risk for later. How do you do this? Manage your blood pressure, manage your cholesterol, manage your weight, stay active, eat heart smart foods, quit smoking if you haven't already, and remember to seek the advice of a healthcare provider. Small steps today can prevent a big emergency tomorrow. Your heart beats for you every second. When it asks for help, don't ignore it. Recognizing the signs of a heart attack can save your life or can even save someone else's, because nothing is more important than ensuring your heart stays strong, healthy, and ready to keep you going. And that brings us to the end of another episode of Secondary Podcast. My name is Dr. Tiwa, and we hope that you've been greatly informed with the topic today. If you have any comments, if you have any questions, please leave them in the comment section below. Thank you very much for listening to us, and bye.